Well, my name for the record is Lynette Menard, and I'm here representing the Northern Rhode Island Chamber of Commerce. The Northern Rhode Island Chamber represents members in Burrillville, Central Falls, Cumberland, Foster, Gloucester, Johnston, Lincoln, North Providence, North Smithfield, Pawtucket, Scituate, Smithfield, and Woonsocket. It's a mouthful. The Chamber would respectfully just like to raise some significant concerns that we have with raising minimum wage to $15 per hour over a period of time. While we appreciate the desire to improve wages, and we share the goal of ensuring all Rhode Islanders have the opportunity to be employed and to have an earning capacity to support themselves and their family, we do have concerns over the timing of this bill and the speed of the bill because of the COVID pandemic that we are undergoing. Last month in the Providence Journal, you might have read, and I'll quote, "Since the outbreak of the coronavirus in March, the state is down 46,500 jobs, marking one of the worst years for losses in Rhode Island's history." That same journal article went on to say the hardest hit workers lost jobs at restaurants, bars, hotels, arts and entertainment venues, and retail shops. Almost all industry sectors gave up jobs last year, with manufacturing and construction suffering the smallest losses. Also, during the 2020 Revenue Estimating Conference that just took place, the state's consultant forecasted that the economic rebound would begin in the fourth quarter of 2020. But they also said it will take time to recover to the pre-COVID-19 levels, and they believe that will not happen until 2023. Until 2023, that economic consultant believed that the unemployment rate will remain in the double digits. So if the state proceeds with raising the minimum wage during the period where businesses are struggling to emerge from the pandemic, we're concerned that it will have a negative effect on businesses and the people they employ. As I have in past years, I just want to quickly emphasize that the costs that go along with increasing the minimum wage include unemployment insurance premiums, workers' comp insurance premiums, and FICA payments, because they're all tied to payroll. Also, Rhode Island remains the only state in the country right now that requires employers to pay premium pay to employees who work Sunday and holidays as part of their normal 40-hour work week. For these employers, the increase in minimum wage is an even greater hardship. Unfortunately, in the situation that we're under, these costs can't be passed on to the dwindling customer base that we are enduring under the COVID pandemic. Unfortunately, while businesses have tried to be creative and remain agile in this world, the current pandemic situation is just imposing significant strains on businesses, forcing many of them to make difficult decisions about staffing and benefits. The Chamber would respectfully ask the committee to consider delaying implementation of a minimum wage increase until after the expected recovery timeframe, so that we can give businesses and their employees an opportunity to regain their footing and begin to grow and invest again. I would also just quickly mention that you should have received written testimony from the Northern Rhode Island Chamber, as well as the Central Rhode Island Chamber, East Bay Chamber, East Providence Chamber, and the Greater Newport Chamber and Narragansett Chamber. I think you'll find that they all express the same concerns. The business community stands ready to work with you. We're confident that together we can find a solution to improve the Rhode Islanders' livelihoods and also make sure that businesses can recover. With that, Mr. Chairman, I'll be happy to answer any questions.
As you stated, my name is Sarah Branco here on behalf of the Rhode Island Hospitality Association. We are the trade association representing restaurants and hotels throughout the state of Rhode Island. We have submitted our written testimony on several pieces of the legislation up for hearing tonight, so in the interest of time, I won't go into the specifics of our testimony on each bill, but I wanted just to take the opportunity to highlight the economic impact felt by our industry this past year and hopefully give some insight into our concerns over this legislation. To say that the last 12 months have been devastating for our industry, particularly here in Rhode Island, would be an understatement. Virtually overnight, one of Rhode Island's largest industries and a major driver of the state's economy was closed down. In the subsequent months, we have done absolutely everything we could to keep our industry open, but every business is struggling, with 85% of operators having said that their businesses won't be profitable in the next 6 months. Our most recent sales data from December indicates that the industry nationally has now entered a double-dip recession. Here in Rhode Island, we use the meals and beverage tax and the hotel tax to track the health of the industry. In October, the latest data that we have, our meals and beverage tax is down almost 17% from 2019. Keep in mind that this was pre-pause, when restaurants were able to operate at 66% capacity and we were able to have events of some type. Our hotels are faring even worse, with the hotel tax down almost 65%. We expect these numbers to become much more dire when we get the November and December numbers, which is when we are in the height of the pause period. Everyone in the industry has been impacted by COVID, including our employees. Pre-COVID, we employed almost 87,000 Rhode Islanders. In the subsequent months, over 36,000 people in our industry have been laid off, with 96% of Rhode Island restaurants forced to lay off employees. In November 2020, data from the Rhode Island Department of Labor and Training stated that leisure and hospitality jobs are still down 18.9%. 71% of operators expect their staffing levels to actually decline in the next 3 months. So while we certainly understand and appreciate the intent of this legislation, we just want to highlight that the timing really could not be worse as we struggle to rebuild from COVID. So with that, I'd be happy to take any questions.
Thank you for the opportunity to testify. My name is Scott Fraser. I'm President and CEO of the Rhode Island Healthcare Association. We represent approximately 80% of the nursing homes in the state. And like other speakers, I'll take the opportunity to express my concerns on all of the minimum wage bills, and then I do have a couple of specific comments on one or two of the bills afterwards. The Rhode Island Healthcare Association is opposed to bills that would raise the minimum wage to $15. For the following reasons. First of all, we're not opposed in principle to a minimum wage increase to $15, but our concerns are somewhat unique to our profession. In fact, most of our members start out their direct care staff at this rate or higher. The problem comes when all staff receive this as minimum compensation. For instance, some dietary staff, many of whom are students, or other employees make less than $15 an hour. And when required to pay every employee at least $15 per hour, this results in all staffers who are making more than this amount to seek an increase in pay, and it kind of bubbles up the line. The minimum wage in Rhode Island has increased 42% since 2012. And in that same time, Medicaid reimbursement to our nursing homes has gone up just 14%. If this passes, other industries such as fast food or retail can just raise their prices on their goods and services to cover the additional costs. Nursing homes can't do this. 65% of our residents are covered by the state Medicaid program, and as a result, we're bound by the state's reimbursement. Since 2012, Medicaid rates have been cut almost every year from what we're required to receive according to state law. And these shortfalls amount to a total of some $50 million just this year alone. So increasing the minimum wage to $15 without a corresponding increase in Medicaid rates will put our members into further financial distress. With regard to Senate Bill 143, we oppose the provision for 1.5 times the minimum wage to be paid during a declared state of emergency, because with no funding from the state, this would put our residents in jeopardy at a time when they most need care. For instance, this year, during the height of the pandemic, we argued and lobbied strongly for $1,000 hazard pay or heroes pay for all of our employees. The state did come through with a $200 a week pay for those making $20 an hour or less, but we felt it important for all employees. And if 143 were to pass, this just raises the wages with no corresponding state funding. So for these reasons, we oppose the legislation to increase the minimum wage. We do support the creation of a study commission, S-136, to look at the minimum wage in the state. Thank you for your time, and if there are any questions, I'd be happy to answer them.
Mr. Chairman, the members of the committee, good evening. The one word tonight that I haven't heard, Mr. Chairman, is the word compromise. I've heard a lot of criticism on several of my bills, and it is kind of comical where you hear that on one bill, Senate Bill number 1, they like the idea as once minimum wage reaches $15, they like the concept of CPI, but they don't like Bill number 77, that is CPI, that 18 other states in the United States have adopted, which, again, it's the fairest way to help business. So that's one word that we haven't heard this evening is compromise. Another word, or two words, that is very confusing is the difference between the minimum wage and living wage. The minimum wage should not be a vehicle to a living wage. If we want to have a discussion on living wage, then we should take the factors of raising children, single moms have to raise a number of children, or parents raising children on minimum incomes. Then we should have a separate wage called the living wage and adopt the different criteria and factors. So there's a lot of confusion. My fear is that we heard about our neighborhood states. Well, we don't follow our neighborhood states because if we do, we can get in trouble. If you look at some of the information that I provided to the committee this evening, the top 25 states, minimum wage, right now there's only 6 states in the country, California, Connecticut, Illinois, Maryland, New Jersey, and New York, that are heading for $15 minimum wage. Rhode Island right now ranks in the country with doing nothing, not even raising it to $15, but adopting Senate Bill 1. It's a very expensive state to do business. It's very intriguing that a study commission is very important to iron out all these differences, all the testimony that was given this evening, because there's a lot of answers. We have to compromise to help small business. I'll give you a perfect example. The state of Michigan, which is a labor-rich state, their minimum wage is not going to reach, it's in one of your packets, the NSSL package that shows all different states. They're going to reach $12.05 by 2030. 2030. So it's very difficult to understand why in New Hampshire, their minimum wage is $7.25. Vermont is $11.75, and it's $12.15, and they've all adopted CPI, and they're going up very, very slowly. So I think it's very dangerous to go right to $15 in 3.5 now, and then try to adopt CPI. We don't know what's going to happen. We don't know what the feds are going to do. We keep hearing about the Biden administration, they're pushing $15 an hour. I don't think that's going to happen because minimum wage on the federal level has been stuck at $7.25, and that's shame on all of us. Here in Rhode Island, minimum wage 2007 to 2012 did not go up at all. And I've been debating this. I've been introducing minimum wage bills for the last 15 years. Why didn't it go up? It's an embarrassment. We should have adopted CPI back in 2007 and we would not have this discussion. My fear is that while CPI has gone up only 10% since 2015, the minimum wage in Rhode Island in the last 6 years has gone up almost over 30%. That's a staggering amount. Last year we went from $10.50 to $11.50, and if you take a small company with 20 employees and that company has to raise its wages by $1, it comes out to 20 employees, 40 hours, $800 times 4.5 weeks, which comes out to $36 per month times 12 months. You're looking at $43,000 increase for a small of 20 employees. Basically, I think big box wins. New York State has 2 stages of minimum wage. They have a minimum wage for large companies like big box, and then they have a different minimum wage for small mom and pop companies, companies under 20. We haven't even addressed that issue. We're treating all companies one shoe fits all. Big box, Stop and Shop, Home Depot, Walmart, BJ's, even CVS, McDonald's, they laugh all the way to the bank. Because the last time I went to a Walmart, I used to see maybe 15 cashiers working. Now I see 2. So they've gone to automation, so they don't care about minimum wage going to $15 an hour because they've reduced the amount of employees. So we're looking at some kind of danger zone that we're approaching. And my estimate is that once we reach $15 an hour by 2024, and then we try to adopt CPI, we're going to see a reduction of companies, small companies trying to operate. I believe the last statistic I saw nationwide is that 30% of small businesses have closed and 30% have reduced their employees. So a lot of these questions have to be answered in the study commission. As far as the tax credit bill, it's the first time I'm putting this bill. There won't be any cost to the state because what we will do use the anticipated revenue on the payroll tax. I know one witness talked about the sales tax or other revenue that probably would be saved because as you're increasing minimum wage, then more and more people would be getting off of state support. We don't know what the answers are. The state has not told us when we went from 1050 to 1150, how much payroll revenue was increased to the state general fund. We don't know that answer. We know that an employee puts in an amount and the employer has to match it. So my concept on bill number 137, it would only take anticipated revenue. It wouldn't have a projected deficit on the budget because it's new monies as we're going to go up from 1150 to 1225 in Senate Bill 1. We don't even know what the amount of revenue collected. We would apply that as a tax credit. And one witness also did give a good point that we should adopt it to small business. But again, I believe that this bill is going to pass this evening. I wish that it wouldn't. Hopefully that we can maybe come back. But I think there's study commission without helping business, small businesses, give them a tax credit, not the Walmarts, not the McDonald's, not the BJ's, not the Home Depot, not the Walmarts. Let's try to protect the small business. And if we don't differentiate between a living wage and the minimum wage, I feel that a 16-year-old up to a 19-year-old, several states have adopted a different tier, 85% of the current minimum wage. You're going to see individuals permanently unemployed because nobody's going to hire a 16 to 17, 18, or 19-year-old untrained and paying them $15 an hour. They might pay somebody that has experience. But I think what's going to happen, you're going to see more of an elderly workforce, retirees coming in and working those $15 an hour jobs, working 10 hours and earning $150 a week. So without a study commission, it's very comical that this Senate and the House of Representatives always pass study commissions every year, to study an issue. If it's somebody to berate a study commission on minimum wage, shame on them. This is the most important piece of legislation that this state always debates. Getting the answers, having people like Len Ladaro from URI, Bryant University, Brown, all the AFL-CIO coming to the table and debate what is the best track, having a substantial, good living wage for those witnesses that testified earlier, and then what is the definition of an entry-level wage, a minimum wage for those youngsters, 16 to 19, college kids that are entering the labor force for the first time? I'm telling you, either small businesses are going to cut back, you're going to see a reduction in hours, or you will see them definitely unemployed. So I don't want to belabor. I know the time's getting late. I provided you a lot of material where Rhode Island stands, but I think that we should be very cautious and that we should also try to compromise. I'm not worried about big box. We want to $15 an hour for a company that has more than 50 employees or 100 employees. That's fine. I have no problem with that. But I have a problem with our smaller businesses that are not going to be able to survive. Like I said earlier, a company with 20 employees, $1 would add $43,200 in payroll alone. Do the math. You still haven't added workers' compensation. That insurance premium is covered by gross salaries, not by net salaries. And that's something that companies pay on their gross wages, workers' compensation insurance. It should be on net wages. So, Mr. Chairman, Ladies and gentlemen of the committee, I hope I tried to enlighten you a little bit, and if there's any questions, please let me know.
So I appreciate your testimony, Senator Raptakis, is very thorough. You made excellent points. I think that your comment there, I have to disagree with good senator from Providence that the vernacular does change over time. You know, and ours has since 1938. And when I just had it here, I just brought it up 1 second. The difference here between a minimum wage is the amount set by law, where a living wage is determined by the average cost to live. So there is a difference in what those two mean. And again, Senator Raptakis brought up a great point. A 19-year-old compared to a single mom or a married couple, you know, some of those jobs that they currently hold, like say maybe, you know, at a fast food restaurant, weren't intended to sustain a family on, you know. But that's a different topic for a different day. The testimony that we have here tonight, I went through it. And the first one that I'm going to read, just a little excerpt here, is testimony from Christopher at the National Federation of Independent Businesses. He says, publicly, everyone wants to help small businesses endure the pandemic, but legislative policies must reflect those desires. It is always important to note that small businesses struggle the most to absorb the cost impact of minimum wage increases, unlike their big box store competitors. Small businesses with a single location cannot spread higher labor costs. Yeah, I have another one here from Heidi. She says she's a business owner. She lists the amount of property taxes she pays to the city of Warwick, sales tax to the state of Rhode Island. These are all sizable amounts, well over $300,000. And she says, if S1 passes, small business owners like myself will likely scale back the number of employees, raise prices to cover the extra cost. So I'm looking at it at the perspective of small businesses have just been devastated. Some of them have closed their doors forever, 40% actually, according to Harvard and Brown. And we're not realizing, I think, the domino effect that has when, for example, you have two employees at a location. One of those employees now, because of the minimum wage has gone up, that employee either loses their job or they go part-time. In both scenarios, that person has lost income, lost health insurance, and possibly not able to pay their mortgage or their rent. And that is also that cost is going to be assumed by the state with unemployment and possibly aid to that person, maybe for groceries, for rental assistance, whatever that is. So we have to look at the whole picture here. How does it affect small businesses, which are the lifeblood of our economy? They employ the most people in Rhode Island. How does that affect them? And how does it affect the people who lose their job because that employer can no longer employ two people, they can only employ one? So for those reasons, I can't support the bill. If maybe in the future we're talking about CPI where we're not just arbitrarily picking a number, you know, we were in committee, on the Senate floor, and one senator said, why not $25? Why not $50? We can't just arbitrarily pick numbers out of the sky. If we're going to raise it, we need to tie it to the CPI, the Consumer Price Index, which makes the most logical sense. Otherwise, you know, there's no rhyme or reason to what we're doing, and I think that being thoughtful about it is the best approach. So thank you so much for that, for my time, Mr. Chair.
Basically, Senator De La Cruz brought up a good point. That's why we need a study commission. There's a lot of questions unanswered. I hope that this committee would look at passing the study commission later on in the step, because I think it's going to help us as we're going up on the minimum wage. The other issue is that you're right. All these businesses are not going to stop at the prices they have right now. So what happens if you give an increase in the minimum wage? When you do go to the McDonald's, the Happy Meal is not going to be $7 anymore. It's probably going to be about $10. So all costs are going to go up. Achieve anything. What gets me is when you look at all these other industrial states, Michigan. So you're telling me in Michigan, when the minimum wage is $9.87 an hour, it goes up slowly. How can people survive living in Michigan? It's probably comparable to Rhode Island in energy costs, housing costs. There's a comparison there. But we just have a runaway train of our philosophy that we got to be with the Joneses, Connecticut, Massachusetts, because they went to 15, well, we should go to 15. We don't know what the consequences are. Even Senate Bill number 1, we have raised the minimum wage every year on January 1st. This way it allows the businesses, when we do pass this legislation in June, they have at least 6 months to prepare, to know what their costs are going to be. Why we picked October last year, I heard some innuendo that's because we're following the federal government. Well, no, we're following what's best for Rhode Island. So if we've done it January 1st, at least it's a standard date. It's the end of the calendar year for businesses. So that's another issue we should address. But I wholeheartedly hope that this committee supports at least the study commission, which would answer the questions on Senate Bill 137 and Senate Bill 77. Thank you, Mr. Chairman.
Yeah, just very briefly, Mr. Chairman, I've been sitting here and listening to all of the testimony. I downloaded and read all of the written testimony that you provided to us, although I may not have received all of it because I know Senator Raptakis referred to a charting system of where various states fall on the minimum wage and whatnot. But I think the perfect segue is my colleague, Senator Casada, aptly pointed out that she co-sponsored a resolution with me that mirrored some of the local councils, particularly my council in Cranston, about the governor's so-called pause during the pandemic. And I think that's a good segue because that reflected, I think, the eyes and ears of local businesses that have been devastated and decimated by the pandemic in general, and then the regulatory scheme that's been put in place by the executive orders, particularly as it relates to the hospitality industry. And Senator Casada was a strong advocate for trying to get the governor to give some relief, at least in some respects, to the so-called pause by adding perhaps additional hours and removing the curfew and that sort of thing. And I think that's a great jumping off point with respect to any discussions regarding minimum wage. And I say, parenthetically, when I look at the bills, Senator Raptakis points out that we've increased minimum wage since January 13th forward for 2015, 15, 16, 18, 19, and then 20, and now we're picking up to go 21 to 24. So by my math, if each of those were done on an annual basis, I supported the increase of the minimum wage at least 6 times since in my tenure over the last 8 years in the Senate. And I'm tempered this year because I think that this year is an extraordinary year. I think we know what's happened, and I'm very concerned. And again, I know people say don't worry about the box stores, but I'm worried, and I agree. I worry about the local mom and pops, the 5 or 6 employees, the 12 employees, particularly in the hospitality industry, that are going to face another burden placed upon them, piling this on and saying, "No, we're going to have to meet minimum wage." And parenthetically, I've always been an opponent of increasing the sub-minimum wage for the service industry because I think the lion's share of those folks do far better than any minimum wage. But and I think that the hospitality industry put it best in their submission to us that talked about things like 96% of Rhode Island restaurant owners have been forced to lay off employees. 85% of operators have said their businesses will not be profitable in the next 6 months. 110,000 restaurants nationwide have closed permanently. The restaurant industry has lost 2.5 million jobs during the pandemic. 42 states lost additional restaurant jobs in December, and 46 in fewer restaurant jobs. The food service industry lost $240 billion in sales. I think that the timing of all of this is misapplied. I think we've got to clearly, I think there are a lot of components to this minimum wage in terms of definitions, in terms of job categories, in terms of family dynamics, in terms of all of those issues that would certainly suggest that a review commission is in order. But I think that I cannot, in this scheme and in this environment, certainly support any unilateral increase in minimum wage, let alone for a year, and certainly not anything that could project over the next 4 years without any sort of scientific or demographic basis for doing so. And so to unilaterally just roll out an increase for the next 4 years, I think would be careless on our part. I think we would defy our roles and our duty as elected officials. And I think so I think we need to take a deep breath and huddle this back to determine what is best for Rhode Island and Rhode Island only on an annual basis. And with that, so I certainly cannot support a legislation at this point in time, and in this, given this pandemic and what's happened to our economy for any extended period of time without any checks and balances and without any scientific basis for doing so, Mr. Chairman. Thank you.